Welcome to Science Easy Tech channel. In this video, we are going to discuss about illness and illness behavior, which comes under Unit 1 in the subject Nursing Foundations. This video will be useful for Bsc Nursing students as well as post-basic Bsc Nursing students. Already I have posted video on concepts of health, definition of health, causes and risk factors of illness as well as factors affecting health. If you have not watched those videos, I have given the playlist link in the description box, suggested end card and iCard. Before moving on to the topic, if you are new to Science Easy Tech channel, just take a moment to subscribe our channel and also to press the notification bell icon in order to get connected with our latest updates. Let's move on to the topic, illness and illness behavior. So what is the impact of illness on a patient and family? So here the patient, he will not be happy. Whenever we are ill, we will be happy? No, we will not be happy. So we will be very much tired, sad, everything. Any illness, the illness can be of two types. One is what? Acute illness, that is sudden onset or rapid onset. The progress is also very rapid or fast. Or chronic onset. Chronic means slow onset. So here it exhibits certain illness behavior which are unique to each individual. So some will be very sensitive, even for a small illness also they will be very sensitive and they will be feeling very hard. Okay, so here each individual is different. So each individual handling the way of illness is also different. Okay, so the illness behavior, you cannot tell that the same illness behavior will be exhibited in all the individuals. It is not like that. It will be varying from one person to another person. Okay, so which are the illness behavior is unique to the individual and are influenced by your age, your gender, your family values, your economic status, culture, education level and mental status. So these are all the various factors which is going to affect your illness behavior. What are they? Your age, whether you are a child, whether you are elderly, young adult. So elderly people and young children and all, no children and all, the behavior, illness behavior will be very much different. Gender means whether you are a male or a female, each will be handling the illness differently. Family values, your family is going to play a very important role in your illness behavior. Economic status, whether you are a upper income group, middle class or lower income group, poor, like that and all. Next, culture is also going to have an influence on the way how we are going to deal with the illness. Suppose some will be, suppose if you are having chicken pox, in your culture, for chicken pox you should not go to doctor because they will not accept it as a viral infection. So they will think it's due to some threat of God, like that, goddess, like that. So based on your culture also, okay, your illness behavior will become different. Education level, how much understanding you have towards the illness, whether you are aware of it or whether you are illiterate, whether you are having knowledge about that illness, everything is going to mind your illness behavior. And your psychological status, in health definition itself we have stated that it is not only physical, it is emotional, psychological, social, everything comes under health definition. So your education level and your mental status level is also going to show your illness behavior. So there are so many stages of illness behavior which is depicted in this table. So the illness behavior is, first one, Stage 1 is experiencing symptoms. Stage 2 is you are assuming the sick role. And Stage 3 is assuming a dependent role. Still more some stages are there. We will see one by one. So first is experiencing symptoms. So when a person is actually ill, okay, he will have certain signs and symptoms. Okay, these behaviors are the way people cope with alteration in function caused by the disease. Suppose if I am having fever, so I may not be able to go to work because of heavy fever, heavy tiredness, headache, like that and all. So there is going to be some change in my behavior which is due to the result of the disease. So they are unique to each individual. If the symptom lasts for a short time or are relieved by self-care, the person usually takes no further action. Suppose I am having headache in the morning, so I am going to take some tablet. So after that, if my headache subsides, then I am not going to go to a healthcare practitioner. Suppose if the headache persists even after taking some minor ailment or a tablet or some rest or some sleep, after that also if it is continuously progressing, then I will be feeling very much worried and I will be contacting a healthcare practitioner definitely. Okay, so suppose if the symptoms resolves by its own, you will not, and if it is going to be only for a short period of time, you are going to go back to your activities and you are not going to take it very seriously. You are not going to take further action on the symptom. Suppose assuming the sick role. Suppose if the symptom is going on to be persist, then the patient will be thinking that some modification is taking place in our body and we have to do something to come out of this problem. Suppose if you think the headache is going on persisting, then you will be going to a doctor for what? For diagnosis and for treatment purpose. Next is stage 3. Stage 3 is assuming a dependent role. During this time, person may be dependent on others and seeks assistance in carrying his ADL, that is activities of daily living. So whenever you are very much tired, you are having fever for 4-5 days continuously, you are not able to get up, so that time you will be taking the help of your family members. So your family members will be feeding you, your family members will be taking you to go to bath, like that and all. So you will be getting the help of others. So that is called as what? Assuming a dependent role. Either you can take help from your family members, or suppose if you are hospitalized, the hospital personnel will be taking care of you, like that. So the patient may have to be hospitalized for treatment, or it can be managed at home. So to facilitate adherence to treatment plan, adherence means you have to follow the treatment plan. The patient needs effective relationship with caregivers, knowledge about the illness, and an individualized plan of care. So here the patient needs what? He has to get adequate relationship, effective relationship with his caregivers, knowledge about the illness, and individualized plan of care is very, very important. Okay, the patient's responses to care depends on a variety of factors, including the severity of the illness, the patient's degree of fear about the disease, loss of roles, the support of others, and personal experiences with illness care. So the patient should have an understanding about the illness. So how you are taking the illness, it depends on how fast you are going to recover. So the severity of the illness is going to play a role here, and the patient support system, whether the family members are there, whether they are able to take care of themselves, take care of the patient, that and all is going to count. And suppose if he is going to lose his role as a breadwinner, if he is going to get any sickness, so that and all is going to affect the severity of the illness. Then the support from others, the family support, economical support, everything matters in this aspect. And personal experiences with illness care, his own personal experience. Suppose if he have the same thing previously and it is a recurrence, so everything is going to affect the behavior of the person. So first thing is experiencing symptoms, assuming the sick role, then assuming a dependent role. Next is stage 4 is achieving resources and rehabilitation. So recovery and rehabilitation might begin in the hospital and conclude at home. So the recovery as well as rehabilitation starts from hospital and it will be ending at home. Most patients complete this final stage of illness behavior at home. Most of them, they will be getting discharged and the phase will be completing at home mostly. Okay. In this stage, the person gives up the dependent role and he will be going back to his normal activities of daily living. He will take up his own role and responsibility. Suppose if he has taken a sick leave, again once after his recovery and rehabilitation, he will go back to his work. So he will start earning and he will do his functions as early, including his activities of daily living and his responsibility okay, carrying his job, everything will be going on in this stage. So this is the last stage. Stage 4 is what? Achieving resources and rehabilitation. So we have seen till now 4 stages of illness behavior. Next is impact of illness on family. How the family members is going to, first we have seen on individual or patient. Now how it is going to affect the family members. Whenever a family member is going to have illness, the whole family is going to get disturbed. And if it is going to be a minor illness, no problem. Suppose if it is going to be a chronic illness or major illness, then even the caregiver's role strain is also going to be there. So whenever any illness occurs, there are role changes for both the patient and the family. For example, a chronic illness creates a stress for the patient, not only the patient but also his family, because it might require lifelong alteration in roles or lifestyle modifications, frequent hospitalizations, economic burden. So once we are going to hospital, the cost of healthcare is becoming very, very higher. So the economic problems and decreased social interaction among family members. So the family members are also going to get decreased interaction. So the family members are also going to get what? Decreased interactions among family members. So the person is going to have economic problems, money also, because of hospitalization, more amount of expenditure will be there. Suppose think he is the breadwinner of the family, that time also he is going to face much more complications. The job, leaves, everything is going to become a problem. Salary, he will not get salary if he is going to take for prolonged hospitalization, especially in private sectors and all. Okay, and the family members also will be feeling what too much of a burden. So it is going to affect in all the way, not only to the patient as well as his family members are also going to suffer. Frequently they have to take the patient to the hospital, so their routine also will be, they also have to take leave from the job. They also have to take much more attention and care for taking care of the patient, depending on the severity of the illness of the patient. So the response of family members to an illness are also individual. Similarly, some families will take care of the patients very well, some will be neglecting the patients like that and all. Some family members want to be with the patient all the time, while the others, no, they will avoid visiting. Suppose if we are having some illness, no, they will not take care of the patient. They will maintain a distance with the patient like that and all. But some people, no, they will be taking care of the patients very well. So it can be in both the ways. Some will be avoiding. Once the patient gets some dreadful disease, they will avoid it. They will not see the patient like that and all. Next is behavioral and emotional changes. People react differently to illness. Individual, behavioral and emotional reactions depending on the nature of the illness. So everyone they will respond to the illness both behaviorally and emotionally in a different way. The client's attitude towards it and the reaction of others to it. So the client's attitude, how he is taking the illness, whether he is taking it very seriously or very lightly. Then severe illness particularly, which is life threatening. So because of severe illness, think that any liver failure, kidney failure, or any heart issues, or any cancer. So everything, no, is going to cause a massive impact on the emotional status of the individual. Okay, so they will have fear. Anyhow, all are going to get it. But because once a disease starts, and if the doctor tells the time that he may be living for 1 year or less than 1 year like that and all, if they are telling some time period, means we will be very much worried, and that worry, that emotional status itself will make a individual more weak. So more than physical illness, the emotional illness is going to cause a very great impact on the patient. Okay, and emotional and behavioral changes such as he will be having what? Shock, anxiety, denial, anger and withdrawal. So suddenly if the patient has been diagnosed, for example, with a cancer, he will be very much shocked, he will be very much stressful, he will not accept initially, it may be wrong, then he will be very much anxious or furious, then he will deny, oh, it will not occur for me, you are telling some lies like that. Then he will have, next stage, he will have anger. Okay, so this Kubler-Ross stages we will be telling. So here Dabda used to tell denial, anger, then bargaining, acceptance like that and all. Next is in this denial, anger. So So anger, he will have anger towards everything. Why this disease has occurred to me? The anger towards everyone, anger towards God, like that and all. And finally he will be withdrawal. So whatever, he will not be interested. Anyhow, I am going to die. So he will be withdrawing from all his activities. Next is impact on family roles. So family roles, his family role is going to get altered whenever a client has any illness. So his role may be changed. Such change may be simple or short term, or it can be long term also. The role can be for a short term or it can be for a long time. So the family and individual generally adjust more easily to short term changes, because if you are going to take 1 week leave, it's not going to have a greater impact on the role change. But suppose if you are hospitalized for a long time, so your role is going to get completely changed. Think that you are hospitalized for a long time, for 6 months, 7 months. That time your wife has to take the role, or vice versa. Suppose if your wife has been hospitalized, then husband has to take the role of all the things. So your role will be changed, everything. So the client and family often require specific counseling and guidance to assist in coping with the role changes. So whenever a mother is taking up the father role, then he will have some confusion. Similarly the other way, okay, so if a father is going to take care of the role of the mother, because of gender indifferences, sometimes it is very impossible, because we ladies used to take multitasking activities and all, but which is a special skill, especially for ladies. So everything is going to get a haphazard when it going to be in the other hand. So your role, if it is going to get changed, definitely whether it is for a male or for a female, it is going to get affected. Similarly males, they will be very good in handling money, paying bills and all, so whenever your husband is having some problem, and if he is going to have some sickness, whether the wife may not know how to pay an EB bill, how to pay a cylinder, like that and all, because too much of dependent on the other end. So the role is also going to get changed. Next is impact on body changes. Some illness results in changes in physical appearance, and family may react differently to these changes. When changes in body image occur, for example, loss of a limb or extremity in an accident, then the client and family members may pass through the following phases, that is shock, withdrawal, acknowledgement, acceptance and rehabilitation. Suddenly a limb has been lost, so immediately you will be having very happy, you will be very much shocked, why this happened to my child, like that and all. Then what, then again slowly you will be okay, you will be accepting it, and you will be undergoing rehabilitation. Anyhow, body image changes, it is going to have a lifelong impact on the nation. Then impact on self-esteem. So once an illness, if it occurs, your self-esteem is also going to get damaged. Okay, so the self-esteem, okay, how others will be seeing us, everything, it is going to affect your confidence. So your confidence is going to get decreased. So self-concept is the individual's mental image of themselves. So whether you are having a positive self-concept or negative self-concept, high self-concept or low self-concept, like that, and the confidence level, everything we will be losing. Suppose if a major illness occurs, so self-concept is individuals' mental image of themselves, including how they view their strength and weakness. Some people, sometimes they will have so much of big diseases, big deformities, body image disturbances, but with that also they will flourish. Okay, the self-concept or the self-confidence is going to play a major role here. Self-concept changes because illness may no longer meet the expectations of family, leading to tension and conflict. Suppose if you are going to have low self-concept, then again it is going to lead to disturbances in the family, leading to tension and conflict. Next is impact on family dynamics. Family dynamics is a process by which the family functions, make decisions, give support to individual members and cope with everyday changes and challenges. If a person in your family become ill, family activities and decision making often get delayed because they are reluctant to assume the ill person's role and responsibility. Suppose think that the father is very sick. Okay, so that time the family the other member taking up the responsibility of the father, they will take some time. So suppose think that a function has been set out. So but since the father is ill, no one is ready to take up and do the function, so they will be postponing it, like that and all. Okay, so other person's role, if the next standby person is not ready to take up the role, then again the whole family system is going to get affected. So in today's video we have seen impact of illness on patient, family, what are all the behavioral and emotional changes, impact on family roles and body changes, self-concept and family dynamics. So under this stages of illness behavior, we have seen 4 stages. What are the 4 stages? Experiencing symptoms, assuming the sick role, assuming a dependent role, achieving resources and rehabilitation. Hope this video is clear for you all. If you like my video, please give a thumbs up, share and subscribe to Science Easy Tech channel. My previous videos link I have given in description box, suggested end card and iCard, or you can watch our channel playlist for more nursing foundation related videos. Thank you friends. Keep supporting to Science Easy Tech channel.